System Chief Medical Officer for Ambulatory Care Services. And I'm very grateful, of course, to Thomas Street Clinic and everyone who's hosted us this morning. This is the longest running freestanding HIV/AIDS clinic in the nation, and one of the two largest still. So we're extremely proud of this institution and everything that Harris Health does. Over the last 2 months here in Harris County, we've been monitoring the exposure to monkeypox. Since the very first case, and really since we began hearing about monkeypox around the world and in our country, we've been trying to be proactive, and especially working through the vaccines that we have, the knowledge that we have, the resources we have, and the community. And the number one message is we're still continuing to do that, leaning forward, working to make sure that we're not catching up, but we're getting ahead of this. Our most powerful tool on this is prevention, and we continue to need the community support on that. I want to start this morning with a piece of challenging news. We confirmed just yesterday that a young child in our community is a presumptive positive for the monkeypox virus. Now, I say presumptive positive because all of our cases are presumptive positives until we get complete confirmation from the CDC. To put it into context, so far we have not yet had a presumptive positive not be a confirmed monkeypox case. At some point that will happen, but so far it hasn't happened. So we are assuming that this will be a confirmed case. It'll take about a week for the information to come back, but we do have a presumptive positive who's a young child. As with all the monkeypox virus cases in Harris County, contact tracing is being done, and we're working to understand the spread of the virus in this situation. The child is currently expected to have a full recovery, is doing very, very well. And here's what we know about the case. This child is under 2 years old. We are in contact and have been in contact with the family, who are fully cooperative. The family has helped us initiate contact tracing with the folks that this child has been in contact with. We are still in the early stages of the contact tracing, so we're not finished. We just began this just yesterday. We still haven't identified the specific mode of transmission, that is, how exactly the child contracted the monkeypox virus. The child has not been in any daycares or school settings, and we're working through the direct contacts the child did have. The child is completely asymptomatic, other than having a residual rash, and the family tells us that other than the rash, that's all they've seen. There were never any symptoms, according to the parents, other than that rash. All of the direct contacts that the child has been in touch with are being offered the vaccine. If anyone obviously is identified as having the virus, they will be directed to treatment, but so far nobody else in the child's circle has been identified as also being a presumptive positive. And so look, this case in Harris County is one of only a handful of cases in young children nationwide. And I understand that it's a very scary thing, and parents have concerns. And what we need to make sure is to be vigilant and understand the risks, not assume the worst, but this reminds us that this is very real. And it's something that we all need to make sure that we're working together as a community to address. And of course, we can't do it alone. We need resources from our federal partners, and that's partly what I'm going to be talking about. But at least we need to do the pieces that we can do. Now, understand this is a very, very worrisome for parents, especially as school is starting back up, knowing that a child in our community has now contracted or is a presumptive positive for the monkeypox virus. It opens up a lot of questions about how this is spread. It makes people very worried. It makes things very tangible. The fact of the matter is, and we've been saying this from the beginning, we always knew that any person in this community can contract monkeypox. We knew that it was possible for a child to be exposed. Anyone can get this virus, so this isn't entirely unexpected. Now, to put this into context, this is a rare case. This would be, as best we know, the 7th case in the country in a child. The only case of monkeypox in a child in our entire state of Texas. In Harris County, including the city of Houston, we've seen 269 cases so far. Only one child. So right now, the focus will continue to be on trying to control the virus in the population where we know it's spreading most. And that's the population of folks who are at high risk, the population we've already defined. And of course, as we know, vast majority of cases are among men who have sex with men. And so that continues to be the focus. Now, what else can we do and what else are we doing? The CDC and the federal government just last week said that vaccine eligibility would now expand to children 6 months old and older. That didn't used to be the case. You used to have to be 18. And so we now have the ability, if a child were to be exposed, they would then be eligible for the vaccine. So that's a step, and with that information, we've been working already for the past few weeks to be in touch with pediatricians, to be in touch with the hospitals and the clinics that see children, and make sure that these healthcare professionals are aware of how to identify monkeypox and the various processes for testing and for requesting the vaccine among children. So those conversations had already started even before we identified this case. We've been having town halls for school districts on how to react if they were to identify a case in their schools, and we know we hope not, right? But at some point it will probably be a matter of time. Now, the way we keep that from happening is to try to surround this virus with the vaccines right now that it's mostly contained to that MSM population. And that's what we're going to continue to do, but the only way we do that is through the vaccines. For the general public, the risk remains low. And Harris County Public Health will continue to mitigate, continue to monitor the situation, and continue with the education, with the outreach, and with the contact tracing and the vaccines. And now, kids can get rashes from many different causes. I understand that. But there is something that you can do as a member of the community, and that is if anyone in your family, including a child, develops a rash, a sore, something that looks unusual, or that you don't know how they could have gotten this, call your doctor. Have the family member tested if the doctor so recommends. It's important to be proactive about anything that looks out of the ordinary. And we know that this virus could look like pimples or blisters or rashes, and of course Dr. Brown, Dr. Purse, and the doctors can give more information. We're working together, continue to work to learn as much as we can about this virus and lean forward as much as we can. Now, I have another announcement to make today, and it's more positive, on the more positive side of things, and it's about expanding eligibility. We are happy to announce that as of this morning, we have expanded the vaccine eligibility criteria to reach even more people in Houston and in Harris County. And that is going to help us remain more vigilant and more easily try to control this virus and keep it from spreading further in the community. The plan as of this morning is, in addition to the folks that are already eligible for the vaccine, we are now expanding eligibility to HIV positive individuals in our community and to individuals in our community who have been diagnosed with chlamydia. We hope eventually we have a plan to expand eligibility to all individuals who identify as men who have sex with men, but right now we can't take that step because of the limitation in vaccines. That's still an issue for our community, as it is for communities around the nation. So we're going to be working with clinics across the county, especially healthcare providers, in serving the eligible populations. And this is a call to action. If you are a person that is living with HIV/AIDS, please get yourself vaccinated. Reach out to us. That will help us contain that virus. And if you qualify according to the other criteria that we had outlined, that is, if you've come into contact with someone who has who's been diagnosed with monkeypox, if you are on PrEP, or the various other categories, please reach out so that we can get you the vaccine. Now, there are nearly 28,000 people in Harris County living with HIV, and obviously the surrounding areas, more folks. So this changing criteria is estimated to quadruple Harris County's vaccine eligible population. And that means that we've been working very hard to expand our distribution operations right now. Harris County Public Health has two permanent sites and a mobile site. We're eventually going to have 6 mobile sites, and I know the city of Houston will have or has multiple sites and efforts as well, which Dr. Peirce will talk about. But to be very clear, we still have a limited supply of vaccines. And because of our limited supply, our strategy will not prevail unless we receive more vaccines. It's concerning, you know, for us to see now a child, right, potentially with monkeypox. And so how do we keep it from reaching the broader community? It's through vaccines. It's through vaccines. So I want to say something on that note. I'm very disappointed in the continued shortage of vaccines we're seeing here in Harris County. We received news earlier this week that, and folks I'm sure saw this in the news, that we were going to be able to use 1 vial for 5 doses. That is, when we initially had 1,000 vials, which were to equate 1,000 doses, 1,000 vials would now turn into 5,000 doses. Anyway, we did the calculations and concluded that in the next few weeks, we could expect to have around 25,000 doses. That's how we confidently moved to say we'll expand eligibility to those living with HIV and those with chlamydia. We learned just this morning from the federal government that they're not just letting us use 5 doses per vial. They are cutting our allocation and dividing it by 5. So in reality, we're not receiving the number of doses that we thought we would receive. We were heartened by the news that we would be able to multiply the numbers of residents we could vaccinate 5-fold. But now they're only going to allocate 1/5 the number of doses to our county. So where we thought we would have 25,000 doses, we're now back at around 9,000 for a county of almost 5 million people. So I have a responsibility to advocate for this community. Obviously, the number of doses, the lack thereof, is not acceptable. And if we want to try to get ahead of this virus, we need more doses so that we can expand eligibility further, so that we can try and surround this before it surrounds us the other way around. So in communicating with other jurisdictions around the state, we're hearing the same thing. It doesn't sound like it was any sort of misunderstanding on our part. And obviously, we hope that the federal government will return to the commitment to simply let us multiply the doses, the vials, by five doses. So we'll continue advocating. In the meantime, here's what we need the community to do. First and foremost, stay informed. If you have any questions, you can reach out to our monkeypox hotline, 832-927-0707. The hotline is available in multiple languages. If you are concerned that you or someone you know may have monkeypox, get tested. Your provider should be able to get you tested. We've been in touch with so many providers around the county, sending all our providers communications on how to do this. If you qualify for that vaccine, contact your provider first. That is best, is to contact your provider. Provider will contact us. If you don't have a provider, you can call us directly. Or if you have no way of getting a test, you can call us directly, 832-927-0707. And to be clear, vaccine registration through Harris County Public Health is only happening via phone right now, 832-927-0707, or via the provider. We're not doing online registration for the vaccine right now, but you can always read more information at readyharris.org or call the vaccine hotline. So we're going to keep working on this. It's still very much in our hands to determine the trajectory of this virus, but we need the tools. We need the tools, and that's that call to action from the federal government for us to receive more vaccines, and certainly the vaccines that we thought we were promised. So let me repeat my remarks in Spanish, and then we'll hear from Dr. Brown, Dr. Peirce, and we'll take questions. Buenos días, quiero agradecerle a la doctora Brown, quien está presente aquí, también el doctor Peirce está representando a la ciudad de Houston, y dos doctoras Russell y Small, quienes representan nuestro sistema de hospitales públicos. Estamos en el Thomas Street Health Clinic, que es la clínica más antigua que ofrece tratamiento para las personas viviendo con VIH y SIDA en el condado Harris. Quiero empezar esta mañana con un pedazo de noticias algo regulares, la verdad. Confirmamos el día de ayer que hay un niño pequeño en nuestro condado que es un presunto positivo de la viruela símica. Todos nuestros casos de viruela símica han sido presuntos positivos, porque después esa prueba se le envía a la CDC y ahí recibimos la confirmación. Hasta el día de hoy, o bueno, al viernes pasado teníamos 269 casos de viruela aquí en el condado Harris. De esos 269, todos los presuntos positivos han sido confirmados como positivos. Entonces, asumimos que este caso, en cuanto regrese la evaluación final, lo cual tomará alrededor de una semana, que recibiremos confirmación de que sí, de hecho, este caso está confirmado como un caso de viruela símica. Como en todos los casos de la viruela, estamos evaluando la propagación del virus, haciendo el rastreo de contactos y también ofreciendo la vacuna a cualquier contacto que salga positivo. Eso es lo que sabemos acerca de este caso. Es un niño o niña menor de 2 años. Hemos estado en contacto con la familia ha cooperado a un 100%. Hemos iniciado el rastreo de los contactos y hasta el día de hoy no se ha encontrado ningún contacto que también tenga el virus. No hemos identificado aún el modo de transmisión, es decir, no sabemos cómo resultó este niño o niña con el virus. El niño o niña no ha estado en ninguna escuela, en ninguna guardería, y estamos todavía trabajando al evaluar los distintos contactos. Todavía no hemos identificado todas las personas que hayan tenido contacto con este pequeño o pequeña. El niño o la niña no tiene ningún síntoma fuera de un salpullido, nada más. Y lo que sabemos es que, de acuerdo a los padres, ese ha sido el único síntoma, no ha tenido ningún otro síntoma. Si es que identificamos contactos que puedan haber sido expuestos al niño, entonces, bueno, ya los estamos identificando, se le está ofreciendo a esos individuos la vacuna. Este caso en el condado es preocupante. Entiendo que ya que estén empezando las escuelas, madres de familia, padres de familia, pues les va a preocupar escuchar esta noticia. El que sea un niño o una niña aquí en el condado Harris realmente hace esto algo que podemos ver, identificar y vivir. Hasta el día de hoy, la viruela símica era algo un poquito a distancia. Aunque ya existía en el condado, era algo que de repente le sucedían a otras personas. Pero ya con un niño o una niña menor de 2 años, se vuelve la cosa más real. Entonces, entiendo la preocupación. Quiero poner esto en contexto. Este es un caso bastante único. Este será el 7º caso en un niño o niña en nuestro condado Harris. Es el único caso en un menor de edad en todo el estado de Texas. Como he dicho, ya se han identificado 269 casos en el condado Harris, incluyendo la ciudad de Houston, y este es el único niño o niña menor de edad. Entonces, sí hay causa de preocupación, pero no estamos aún en una situación en la que podamos decir es alta la probabilidad de que hayan casos en las escuelas. Y como dije, este pequeña no fue a ninguna escuela ni ninguna guardería. Entonces, seguimos el enfoque en las comunidades donde hay más presencia del virus, específicamente la población de hombres que tienen sexo con hombres y las poblaciones que ya hemos identificado como poblaciones de alto riesgo. El riesgo para el público en general aún es leve. Nuestro Departamento de Salud Pública continuará monitoreando la situación, intentando limitar la transmisión a través del rastreo y las vacunas. La CDC, el gobierno federal, la semana pasada, de hecho, expandió la elegibilidad a las vacunas. Entonces, desde la semana pasada, ya los niños mayores de 6 meses de edad califican para la vacuna. Antes de eso, tenían que tener 18 años. Eso significa que si se identificara algún niño o niña que hubiera estado en contacto con otros niños, podríamos vacunar a los niños. Entonces, ese es un paso muy importante, algo positivo. Ya desde hace varias semanas hemos estado en contacto con guarderías, con escuelas, todos nuestros distritos escolares, con pediatras, hospitales que tratan a niños, para informarles acerca de cómo identificar el virus, de cómo hacer la prueba y de cómo vacunar a los niños. Entonces ya estamos listos por si fuera a aparecer un brote en alguna escuela. ¿Qué puede hacer usted? Infórmese de qué se trata la viruela del mono, cómo se ve. Puede encontrar información en readyharris.org. Como siempre, les invito y les pido que acudan a fuentes de noticias oficiales. Las noticias aquí, nuestros canales locales, el readyharris.org también le puede ofrecer información detallada, o hable con su pediatra, con su médico. Si es que identifica alguna cosa extraña en la piel, a veces parece acné, a veces parece un brote, algo extraño, contacte a su doctor. Si no tiene doctor, contáctenos a nosotros al 832-927-0707. Estamos disponibles también en español y en varios otros idiomas. Nunca se le cobrará por una consulta a través de nosotros, ni tampoco por la vacuna. Entonces, seguiremos trabajando juntos en eso. Otro anuncio, y este es un anuncio más positivo. A partir de esta mañana hemos expandido los criterios de elegibilidad de la vacuna a incluir un nuevo grupo o 2 grupos nuevos. Entonces, a partir de esta mañana, las personas viviendo con VIH o con SIDA también calificarán para la vacuna en nuestro condado Harris, y también aquellas comunidades con clamidia. Entonces, esto es buena noticia hasta el punto de que entre más personas vacunemos, más fácil nos será controlar el virus. Pero la limitación, como siempre, es la cantidad de vacunas, y todavía tenemos un reto grande con eso. Entonces, con este nuevo anuncio se multiplica un 4% el número de individuos en el condado Harris que califican para la vacuna. Todavía necesitamos un incremento sustancial, un aumento sustancial en el número de vacunas a nuestra disposición. Y quiero decir una nota sobre ese tema. El gobierno federal nos había contactado esta semana, esto lo ha reportado ya las noticias, nos habían dicho que podíamos multiplicar el número de dosis por 5, es decir, lo que creíamos en un momento que calificaba o era una dosis, ahora se podía usar para 5 individuos, que podíamos diluir las dosis. Entonces eso significaba que a finales de estas próximas semanas habríamos tenido 25,000 dosis para nuestro condado, más de 25,000. Ahora nos llamaron anoche y nos dijeron que sí podemos diluir las dosis, pero que nos van a enviar solo 1/5 de las dosis que nos habían prometido. Entonces, estamos esperando 25,000, ahora solamente tendremos alrededor de 9,000 dosis disponibles. Es un problema grande para la comunidad. Miren, identificamos un pequeño, una pequeña con el virus. Queremos poder rodear este virus antes de que el virus nos rodee a nosotros. Pero para eso necesitamos las vacunas. Y como líder de este condado, le pido nuevamente al gobierno federal que nos envíe las dosis que necesitamos, que nos habían prometido ya básicamente estas 25,000 y ahora nos las cortan a 9,000 anoche, cuando ya habíamos armado todo este plan. Tenemos la capacidad de distribuir las vacunas, hemos establecido una sede permanente, 2 móviles, vamos para 6, la ciudad tiene aún más sedes y seguiremos trabajando, pero necesitamos más vacunas. Entonces, para aquellas personas que ahora son de estas categorías que también pueden recibir la vacuna, visiten con su médico. Si califican para la vacuna, es lo mejor, el médico nos puede contactar a nosotros y recibir la vacuna. Si no tiene médico, llámenos, 832-927-0707. Si califica para la vacuna, si ha estado en contacto con alguna persona que tenga la viruela símica, o si es de estas categorías de personas que califican hoy día. No, en este momento no estamos aceptando registros por medio de la vía web. Entonces nos puede llamar al 832-927-0707. With that, I'll pass it on to Dr. Brown, our local health authority for Harris County Public Health.
Thank you, Judge. As Judge Hidalgo said, Harris County Public Health and Houston Health Department are working in partnership to expand our criteria to those living with HIV and those who have had recent exposure to chlamydia. We recognize that there are many vulnerable populations whom the CDC states qualify for vaccine and should be vaccinated. But again, as Judge Hidalgo said, unfortunately, we just don't have enough vaccine. So we are also working to support our local leaders in advocating to our federal government for additional allocation. And as soon as we can, we hope to be able to expand that criteria even further. And with that, I'll turn it over to Dr. Pearce.
Thank you, Dr. Brown. I just want to echo everything that the judge said and Dr. Brown said. But the point that I want to add to the conversation is that the city and the county, our criteria are moving forward together. They're the exact same. In fact, if you look at some of our documentation, they are co-branded. That is not by chance. That is an intentional, coordinated effort. Dr. Brown and I are in contact basically daily, and that includes the weekends, where we are working with other colleagues, infectious disease doctors across the region, and others to keep up on what is the most current new information we have about monkeypox. One thing I want for the reporters to understand is that while monkeypox has been around for decades, it has never been in the human population to the scale that it is today. We are going to learn new things about this virus that we don't currently know, particularly in terms of modes of transmission and how transmissible it is, the consequences for people who have risk factors for getting ill. As we have expanded the criteria, in addition to trying to keep on top of the most current science so that we can be as strategic as possible with the vaccine that we have, we also have to balance, as the judge pointed out, the limited supply. So at this point, I don't want anyone to think that this is perfect. Our eligibility criteria has been expanded. The amount of vaccine we have is not what we would like it to be. And the other wild card is we don't know exactly how many people within the eligibility criteria are going to want the vaccine that will then sort of, impact our consumption rate. Does that make sense? So one thing we don't want is we don't want to be sitting on top of a lot of vaccines. So we're trying to match the vaccine supply we have with the most accurate science that we have with the anticipated demand. And, we're doing the best that we can. And 2 weeks from now, we may make another adjustment. And I hope that you'll recognize that we have to do that and why we're doing it. And with that, I give it back to Judge Hidalgo. Thank you.
Thank you. Dr.